Why do we collect the right specimen for the right test? Here's your MedLab MCQ of the day. Question. Which specimen is least likely to provide recovery of Trichomonas vaginalis? A. Urine. B. Urethral discharge. C. Vaginal discharge. D. Feces. Correct answer. D. Feces. Explanation. Trichomonas vaginalis is a flagellated protozoan parasite that infects the urogenital tract, mainly the vagina in females and urethra in males. The best specimen for detecting Trichomonas vaginalis is vaginal discharge, especially when collected during a pelvic exam. Wet mount microscopy or nucleic acid amplification tests, NAATs, are commonly used on this specimen. Urethral discharge is also a good specimen, particularly in symptomatic males. The parasite can be recovered from the urethra because that's where it colonizes in men. Even urine, especially the first voided urine, can be used for detection, mainly when using NAATs. This is useful when urethral swab collection isn't feasible or is uncomfortable for the patient. But what about feces? Feces is not a relevant specimen for Trichomonas vaginalis because this parasite does not inhabit the gastrointestinal tract. It doesn't survive or multiply in the intestine, and there's no diagnostic value in testing stool for this organism. That's why recovery from feces is least likely. So, when you're asked to collect a sample for suspected trichomoniasis, never go for a stool specimen. It simply won't help. Quick recap. Vaginal discharge equals best for females. Urethral discharge equals good for males. Urine equals acceptable, especially with molecular tests. Feces equals not suitable for Trichomonas vaginalis. Always remember, the right test starts with the right specimen. If you watched till the end, drop an emoji in the comments.